shift our focus to the UK, where remember lockdown restrictions are going to considerably be eased from July the 4th. So the UK will see restaurants, hotels, bed and breakfast, salons, etc., all opening up from the 4th of July. What does this mean and what should people be wary of? We have Dr. Veer Pushpak Gupta who's joining us on the broadcast. He works with the NHS. And Doctor, allow me to introduce you, to our viewers. He works with the NHS. He treats COVID-19 patients on a daily basis, and he had the coronavirus himself. So you contracted the virus, Dr. Gupta, while you were treating COVID-19 patients in the NHS, which is the public healthcare service in the UK. Before I get down into understanding what this unlock in the UK means, tell us a little bit about your experience battling the coronavirus.
Well, thank you for having me on the program. And good evening to all our viewers in NDTV. I was treating patients back in March when we first had the first wave of virus infected our patients in the UK. And it was at that time when I was treating patients that I had initially gotten infected. I was admitted to the same hospital where I worked. I had multiple admissions. Thankfully, I did not need any ICU care, and my symptoms resolved with a bit of isolation and self-treatment. And I was much better afterwards and went back to work. So it was quite a difficult experience, but it was something that we had expected. A lot of my colleagues were infected. A lot of my seniors and juniors and nursing staff were infected. Physicians of Indian origin seem to have been infected disproportionately in the UK, especially people from the subcontinent,
right.
Black, Asian minorities. So we saw that we were being infected disproportionately higher
right.
than the rest of the population.
How difficult has it been? Several doctors like yourselves fighting on the front lines of the coronavirus. You've been separated from families, maintaining physical distancing. Many doctors choosing not to go home to see their families, especially those who have children or older people. How difficult has this time been?
It's been a very challenging time. For me, myself, some of my colleagues, we have been, away from family. We have been treating patients for the last 3 to 4 months. I had time off because of sickness. Some of my colleagues have taken time off because of stress. I know some colleagues of mine that have actually passed away from it in the initial surge in the UK. So it has been a very difficult time, mentally, physically, emotionally, in all respects. Yes.
Right.
And I think I say that for all doctors around the world that are treating this.
Well, absolutely. And, on behalf of our viewers and everyone watching this broadcast, I'd like to say a big thank you to you for your service and a big thank you to your colleagues as well. But, I want to also ask you, the UK is at an interesting juncture at the moment. 4th of July is when lockdown restrictions are going to considerably be, eased in the UK. The UK has taken its time as opposed to the rest of Europe or the rest of the world. What's your take on lockdown measures being lifted? Restaurants, hotels, community centers, museums, everything's going to be opened up from the 4th of July.
Yes. 4th of July is the day that we're opening up the United Kingdom. Only very few services will remain closed. Most other services will open. My personal take on it is that it is slightly early to be doing this at this stage. You see, countries that fought the coronavirus very well had 5 things in common. They had a very strict lockdown very early on. They had strict travel restrictions, strict contact tracing, mask wearing in the public, and then also PPE equipment available to their doctors and nurses in the hospitals.
Right.
The UK and the US both have been very slow in all these 5 steps along the way. And that's why we have seen such a high number of deaths in both these countries. The lockdown was then relaxed about a month ago by the Prime Minister over here, with not very clear rules as to how people are supposed to go about. There was just mixed messages going on. Mask wearing was not compulsory. And as you saw a couple of days ago on a beach in the UK where thousands and thousands of people were there and there was no social distancing going on. So
Right.
I think that we're at a very, very delicate juncture here. And most scientists say that we have a fine balance at this point
Right.
as to which way things can go. And July 4th will be interesting to see which way things go, but I think that it is a bit premature, in my opinion.
I want to also ask you about, the high death rate that's been reported in the UK. It's been consistently higher than the average all over the world. What do you make of the numbers? And the UK still continues to remain in the top 5 worst affected countries with a high death rate. Do you feel like the numbers may spike once lockdown restrictions are eased?
Well, there's a few reasons for the high death rate in the UK. I think initially it was a very slow response from authorities to take this seriously. When we saw countries like Italy, when we saw countries like China having issues with coronavirus and their healthcare systems were being overwhelmed, it is at that point that we should have acted and gotten ready for this virus. I think that is one of the major reasons that the death rate initially was high, and that is why the overall number seems high even now. But I think it was that initial surge that happened, which was quite bad. Things have settled down now. Even in the places where I work, I have seen lower numbers of patients being admitted with COVID-19 and more numbers being discharged. I think also we do have a better understanding of the virus now in terms of the medications to give and how to treat patients, especially when they're in ICU settings. So I think a lot has evolved. The clinical trials that are taking place at this point have given us some methods of treatment which are helpful.
All right, Dr. Veer, appreciate you joining us on the broadcast. You're a frontline COVID doctor. Once again, thank you for your service, and we're glad that you made a full recovery despite being infected yourself. You're back here, and of course, sharing your thoughts. Thank you very much for joining us.
Thank you very much for having me. Thank you.
All right, let's now shift our focus to the other big international story we're tracking.